I've sent all of them the press release from the Department of Health regarding vaccinations and they're opening up to vaccinate groups 1D on Monday, in particular those ages 80 years and older. And so, Jason, did you maybe want to start off with information regarding that as far as where the health system is at?
Sure. Thanks. Good afternoon, guys, and thanks for taking the time here. What I would maybe start off with by saying is that this is a very fluid process, and fluid meaning in that allocations that we are able to receive within this state are really dictating how we can deploy vaccine and vaccinations. And so as we move forward, we are just in the process. Actually, tomorrow, it is our hope that we will be completing the Group 1C. And so we have vaccination clinics going on today and tomorrow to complete, hopefully, or at least offer the vaccine to all those in that Group 1A, B, and C. Those groups are much more defined and easier for us to target than when we get to 1D. And you have the information on the individuals that are in 1D, but we start to get into a pretty good amount of population. Actually, it's roughly, according to the state estimates, it's roughly about 265,000 people across the state of South Dakota. That obviously comes with many more challenges in trying to figure out, one, how to target all those individuals, and then also try to look a little bit more at the vulnerability of people as it relates to COVID and who might be more vulnerable than the others from a standpoint of just the infectious disease and how it's impacting people based upon age. And so the decision, again, was just kind of relayed to us last night on a phone call with the Department of Health of breaking down 1D and thus the communication that came out today. And so as we begin to break that down within our community, the fluidity really needs to happen in how do we handle that? How do we target those populations? How do we make some of those things happen? Again, understanding that we're just completing 1C. And so there is planning and meetings that have been scheduled. We have worked and talked with the local county pod. They have a meeting tomorrow to begin planning for more of a potential for more of, I'll call it a mass vaccination process. The challenge with the pods is really the amount of allocations that we're receiving. And so at this point in time, which is unknown at this time from a future standpoint exactly what we'll be able to get in the state of South Dakota. But at this point in time, we're only getting roughly about 11 to 12,000 doses to work with. And that will hopefully uptick as more progress happens on that side of the fence. But we're just not knowing that at this point in time. To break that down even further, Brookings Health System in Brookings County is only receiving roughly about 200 to 300. That's been kind of our weekly allocation of vaccines. As you can tell, when you look at that and apply that to the 265,000 people that are in Group D, and I'm sorry, I don't know exactly off the top of my head how many of those are in Brookings County, but it's a significant amount. It's thousands of people. It's a long period of time if our allocations don't change before we are able to make our way through Group D. So our intent is to start hopefully next week, and our allocation is still in that 200 to 300 range. And we will begin to look at what, again, is the most vulnerable group in that. The state has mentioned 80 years of age and older. We also believe that persons with 2 or more underlying medical conditions are very important to target and try to hit. And so we're in the planning stages of trying to figure out how to make those things happen.
So is there anything we can tell people yet about how they would be able to go about getting a vaccine, who to call, where to schedule an appointment, or anything like that? Or would it be truly the pod style event?
So at this point in time, notification was really, the meetings were just held last night. So we are working on trying to stand up I'll call it, for lack of a better word, a contact us and even a call center from a county perspective. It's pending. It's just, it takes us time to stand those things up. And so, but our hope is that we will have some level of communication process that will be going out to folks within our county that will identify them. They will then identify themselves within that subgroup. And they will say, okay, yes, I'm over 80 years old. Here's my opportunity to get my vaccination. I'm supposed to call this number, or I'm supposed to reach out to this place. And then we will then schedule those folks, because there has to be some level of scheduling associated with this. Otherwise, we will have lines of people like you see in some other states and some other places. And that's just not a very good use of, one, people's time, and probably two, our time to be able to make some of this stuff happen. So there's lots of things that come along with the vaccine. It's not like your flu vaccine. We actually have to monitor these people for at least 15 minutes after they receive their vaccine. Obviously, we're dealing with distancing and other guidelines associated with COVID that we're trying to deploy at the same point in time. So we want it to be as structured as possible. And right now, we're not alone in that. Everybody is trying to figure out what's that process to try to make that happen. And again, the limiting process for some of that is we just don't have enough vaccines to really do a big pod event. And hopefully that might change in the future. And we'll have some more of that, and we'll be able to, coordinate people coming through at a various different time. But right now, we're going to try a more targeted approach. So we will be more than likely targeting those individuals and reaching out to them and identifying them either by age or by medical condition, or also in that group or some other people, congregate living settings. So we might be targeting those populations and reaching out to them to make that happen.
Jason, would that happen through people's doctors, for example, if they have two underlying medical conditions? Or, of course, if they're over 80, it's a little more clear cut. Does that go through the doctors and the clinics, or how would that work? Do you know at this point?
Good question. I think the answer is we don't really know at this point in time. I will say that I have reached out to the clinics in town. So my guess is that the two or more underlying medical conditions, I do believe Sanford and Avera will be identifying those people through their electronic health records and be reaching out to those folks, because that's where that is more likely to happen than from a hospital perspective. And then it might be something else on the people that are over 80, or as we work down these age groups, or the people in a congregate living setting. So it's a little bit of a mixture of both different formats that might have to happen with this group 1D.
Jason, has Brookings County seen more of the Moderna or Pfizer vaccine? Has it been a mix, or primarily one or the other?
We have seen more of the Moderna vaccine at this point in time. The allocations seem to be coming to us on that front more than the Pfizer.
And those are the Moderna is a little easier to handle too, isn't it?
It does have a better handling and storage capacity for us, and that's part of the reason why we have seen that. Pfizer has been allocated to the larger metro areas because they have the freezer capability of handling those, where we have Moderna, we have the capability to store that here, and then we have, if it's refrigerated, I believe it's up to about 30 days to use it. When you open a vial and bring it out, you only have about five days, I believe. So. But that's part of the reason why we're seeing more Moderna.
Gotcha.
You use the term, Jason, a pod, and understandably, the way you described it, this is not going to be a pod per se. So there is not going to be one central location that they will go to for these vaccinations?
It's just really, unfortunately, I wish that were the case, John, and I wish we could do that. But the allocations for a pod, let's face it, in order for them to be efficient, to stand up a pod takes a lot of resources. Not to mention, it takes a lot of resources on our behalf here too to do this. But to do a pod you're talking, my initial conversations with Bob Hill and his team, we were thinking that, until you have 1,000 doses available, it really doesn't make sense to go stand up a pod in, the Swiftel Center or some other location that we might have to put in place a pod. So I think the answer there is until we have allocations that support a pod, we will probably not be able to go that route.
Jason, how's it gone so far with
then,
I'm sorry, go ahead, John.
They be going to get their shots to the clinic or their doctor's office?
I think it'll be. Yeah, I think it'll be a mixture. I think we're going to kind of look at all sorts of avenues here. So I think, today, for the most part, lots of those shots have been happening through the hospital, and we've used our conference rooms to make some of those things happen for the 1A, B, and C. Obviously, some of the residents, we did that, those in place. And then same has kind of held true for the clinics that have had some access to vaccines. I think in the future, we'll probably use the clinics. We may be using some travel teams to go out to places to make some of this happen. The pods might be in play here if more vaccine comes our way. And then obviously we may have to try to figure out how that might work in the hospital environment to find some space to make some of this happen. And again, with all the distancing and guidelines in place and the 15-minute really monitoring of symptoms and some of those things after the vaccination to make sure people are good to go, it takes a lot more space to make this happen than it may have happened for the flu vaccine or something else in the future.
Jason,
it sounds to me, Jason, a little bit like a moving target with those various subsets within one delta. Then you will go down the line there as you get more vaccine and kind of keep that procedure going.
Most definitely, and along that line is the kind of, I say, fluidity associated with this is there's so many moving parts. Communication becomes so critical. That's why we're trying to do this. We're getting lots of people that are calling in wanting to get vaccinated or get on the list. What I would encourage people to do is, hold on. We will get to you. Realize that vaccine is very limited, and we'll try to get to you as soon as we possibly can. We will put out lots of communication when it's your turn. You'll have the ability to call in. You'll have the ability to get scheduled, or we will be reaching out through some other format to you to make sure that happens and get you part of whatever process that is that we kind of figure out how to work through this big group of individuals.
Jason, how's the participation been so far? Do you have any idea? I mean, I think with healthcare workers, it must be in their benefit, obviously, to get vaccinated. But some of those other groups, like police officials, things like that, how are the vaccinations going? I mean, are you seeing 100% participation, 95%? Do you have any idea?
Sure. So I think it varies by group. And so you're right. I think most frontline healthcare workers, they've been exposed to this. They've seen the challenges associated with COVID. They've seen people, have many challenges with that. So they're more apt to get probably the vaccine. And I think others who in other categories probably aren't as apt to do so. And we haven't seen as much of an uptake in some categories that we've seen in 1C. Now, that being said, I think we're right around that 55% uptake in the population that we've seen through A, B, and C. Again, don't have C all done, so there's potential that might be a little high because we have seen some individuals or some groups in those categories, maybe a little bit less than that 50-60% category. But right now we're in that in between there from a percentage standpoint.
When it gets to the whole population, what is the effective number to basically have immunity? Is it like 80%, something like that?
Oh, boy, don't quote me on this, but I've heard it's somewhere right around there, that 75-80% kind of immunity range is what we would need to try to achieve.
Jason, is there pretty good assurance that a second dose is going to be available after we march through these groups here?
Okay, so what we've been doing up to this point in time is the allocations have been basically being withheld, and so they've been guaranteeing the second dose. Now, there's lots of information out there over the past few days of how they're going to try to handle that differently moving forward from a supply perspective. I will tell you that there's a lot of varying opinions in regards to whether or not that's beneficial, how long immunity lasts, lots of other things associated with that. So if individuals only are able to get one dose, we would think that there's possibilities. We just don't know enough information of how long that might last. And so we, in this state, as of yesterday or last night, have talked about, we want to get vaccine out as fast as we possibly can. However, we also do, as we move into some of these very vulnerable groups, 80 and over and 2 underlying medical conditions and 70 and 65-year-olds, we all seen what the virus does to this population. And so we want to try to make sure that that second dose is available for those individuals. So those allocations have, up to this point in time, still been coming out to guarantee that second dose. I don't know what that looks like in the future. I personally would like to see us still continue to try to guarantee those second doses because I think it's best from an immunity perspective and certainly for this population that we're moving into.
Jason, any reports of adverse reactions to the vaccine in Brookings County that you've heard of?
We have not had any at our location that have been anything outside of very minor reactions to the vaccine.
We got all we need, Jason, unless you got more to throw our way.
Anything else you have, Terry?
No, I think I'm good. Thanks, Jason. Julia, appreciate it.
Yep.
Yeah, the only thing I
right.
would say is the only other thing I would say is if I could just stress that the grace and certainly some patience in this process. We are doing the absolute best we possibly can given what we're getting, and we're not sitting on vaccine. You've seen that South Dakota ranks up there in the top 2 or 3 or 4 or something in the country on getting out the doses. So kudos to my staff and to staff around the state through Avera and Sanford Monument and Prairie Lakes up in Watertown and some others that are working through this process to make some of this happen. So lots of things happening, very fluid process. We're doing a great job getting it out, and we'll continue to do so.